afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Amita. She is going to talk about the importance of scans during pregnancy and the preparation. So, stick around until the end and ask us any questions if you have. Let's not keep you waiting any longer. Dr. Amita, you have the stage.
Thank you. Hello, everybody. I'm Dr. Amita. I'm the head of the Department of Fetal Medicine in Apollo Cradle Hospitals, both Kondapur and Jubilee Hills, Hyderabad. So, today we are going to talk about something that is really, really basic. So, we are going to address the questions as to why do we really need scans in pregnancy? What are these scans, and what are we actually looking for in these scans, and how the patients, or you can come prepared, or both mentally as well as if there is any requirements for the scans. So let us start from the very beginning. So when a patient or a mother is, the pregnancy just begins, so you've just realized that you're pregnant, and the first visit to the doctor is ideally as soon as possible. Earlier, there used to be this concept: wait for a few weeks, wait for a few months, go see the doctor at the fifth month, go see the doctor at the third month. It's not like that. So the earlier you visit the doctor, the better we can take, precautions, better we can plan the care of the pregnancy. So once anybody has kind of missed their periods and they realize that they are pregnant, it is better to visit the doctor. Of course, when you visit the doctor very early, say that you come in somewhere around just like a week past your expected date of period, or just very early stages of pregnancy, we probably will not want to do a scan that early, unless there is some kind of abdominal pain or we are thinking of something else. So that's simply because the very early stages of pregnancy might not show up on the scan. Ideally, an early pregnancy scan can be done around the sixth week in any normal person. So the in sixth week when we do a scan, it is ideally a transvaginal scan. So that is something that you need to come prepared for. You need to be mentally prepared that it might be a transvaginal scan, and of course you can prepare yourself for that. The reason why we are doing a transvaginal scan is because everything is so tiny at that stage. Even the tiny embryo that we are seeing is going to be like maybe a millimeter or maybe 2 millimeters. And when we do an abdominal scan, especially if the mother is a little more on the heavier side, there is every possibility that we might not even be able to see the tiny embryo, leave alone to check if there is a heartbeat or not. So, which is why we do a transvaginal scan. It gives us a better resolution. We are able to see things clearer, and we are able to measure very tiny structures much better. And another advantage is we are also able to look at the uterus and ovaries closely. So we are able to, give a check and see if everything is okay for that period or not. So that will be your early pregnancy scan or your confirmation scan. So as we go along, please feel free to, drop in your questions. So we'll take them as and when possible. So we can handle the questions, relevant to the topic as we discuss them. So that is the early pregnancy scan. The next scan will be your first trimester screening or your NT scan. Now, a pregnancy, the most important screening process happens around the third month. That is the time of the NT scan. Now, NT scan, earlier it used to be called as the Down syndrome scan or the third month scan, but it is not just about Down syndrome. We are looking at a lot of other things at the time of the third month scan. The NT scan is done between 11 weeks and 13 weeks, 6 days. So it is very important that patients realize that this is a very time bound or a limited time period when this can be done. So it is important that if you need to take appointments or anything, you plan ahead and get your appointments in the appropriate time. When we look at the baby very close to 11 weeks, the baby is going to be very small. It is probably going to be about 4.5 centimeters. And for us to be able to look at organs in such a tiny fetus is going to be a challenge. Closer to 13 weeks, 6 days, the baby is going to be much bigger, almost double the size. It will be around 8 centimeters or 8.5 centimeters. So by then, we are able to see most of the major organs much better. But again, at this point, we do in our NT scan, we also do a blood test called as a double marker or a pentamarker. Now, these blood tests don't perform that great when we go towards the 14 weeks. So ideally, we have a compromise. We prefer to do the NT scan somewhere around 12th week when we can do the examination of the fetus better, as well as the serum markers, which are relatively, they have a good sensitivity at that point. So in your NT scan, things that patients need to know is it is time bound, and the things that we are looking for, or the things that we are screening for in this time period, is we are looking to see if the development of the fetus is normal. Is there any major structural abnormality? So abnormalities can get picked up as early as 3 months. You don't really have to wait all the way till your fifth month for some kind of a major anomaly to get picked up. For example, if there's, hands or feet are not properly formed, or if there is a major cardiac abnormality which is not going to support life, or if the skull is not properly formed. These are structures which are developed very early and can be detected by your first trimester scan or your NT scan. In addition, we are looking for markers of chromosomal problems. So we have a set number of markers which are done according to very strict criteria. Now, this is where it would be preferable that you get your scan done in a proper fetal medicine unit, because each of these markers, even a tenth of a millimeter, can make a difference in the risk calculation. So it is important that these markers are done as per the world standards or the criterias, so that you get a reliable report. So we look for structures, we look for chromosomal markers. In addition, we also look for evolving problems in the pregnancy. Like, for example, the mother might develop preeclampsia or hypertension in pregnancy. This might not happen till around the seventh or eighth month. But if we can screen at third month and red flag it saying that, look, there is a risk, so we need to take precautionary measures, that can be done as early as 13, 14 weeks. And only if these measures are started before the 16th week do they have effect. For example, you will be started on a tablet called ecosprin if there is a high risk for the mother developing hypertension in pregnancy, or if there is a risk that the baby might have growth issues later in pregnancy. So this is a preventive measure, and this works well only if it is started early. So it is important that your first trimester scan is able to identify or look for all of these things, and which is why it has to be done by a fetal medicine specialist who is well qualified. So when you come in for your first trimester screening, the things that you need to do, or the things you need to expect and be ready for are, I mentioned the time period to you. In addition, when you come in for the first trimester screening, the certain questions are going to be asked. Your height, weight, and blood pressure will be checked. They are going to ask you details about previous pregnancies. They are going to ask you details about the type of conception. Is it a natural conception? Is there any IVF? Was any IUI done? So if there is some kind of artificial reproductive technique done, then we will ask for those details. For example, if it is an IVF pregnancy, it is very important that the patient carries the IVF file, simply because we will need details like when was the egg retrieved, the date, exact date that the egg was retrieved, We will want to know the stage of the embryo when it was transferred, what was the date of the embryo transfer. We will want to know what injections or medications the patient's on. So it is very important that the patients carry a complete file, and if not, they should be aware of these details and should be able to give them to us at that point. So usually the NT scan or the first trimester screening is, majority of the scans are done transabdominally. That is, the scan is done from over the abdomen. Sometimes, if the baby is not in position or if the imaging is not very clear, then we might have to do a transvaginal scan also. So patients need to be aware of that. And sometimes imaging or the measurement of the cervical length, which is very important to predict the risk of preterm labor, might require a transvaginal scan. So this is about the early stages of pregnancy. Later in pregnancy, we come to the fifth month. Usually after the NT scan, which happens around the third month, unless there is any risk factors, we don't do any scans in between until the fifth month for the anomaly scan. Patients who are at risk might have some scan in between. For example, you might have a scan to check the cervix. You might have a scan for a early anomaly scan, so that to rule out any possible structural abnormality early. Or there might be an early fetal echo to look at the heart a little more in detail and to try to identify problems early if there is. So these are exceptions rather than the rule. Then we have the anomaly scan that I was talking about. So that is the TIFA scan or the anomaly scan or the target scan. So this is roughly between 18 to 22 weeks. This is when a detailed examination of the baby is done from head to toe, and all the organs, structures, development, growth potential, fluid in the pregnancy sac, the blood flows going to the uterus, to the baby, all of that is checked. This scan, the fifth month scan, is the most important scan in the entire pregnancy. If for whatever reason the patient has to or can do only one scan, then this should be the scan that they opt for. The anomaly scan is the most important scan. So, as I said, we are looking for abnormalities. In addition, we will also be screening for risk of growth problems, risk of mother developing hypertension, risk of preterm labor, all of those things also. So it covers a lot. Now, this scan, one, it is done between 18 to 22 weeks. So patients need to get their appointments appropriately. And majority of this scan is done transabdominally. Rarely we might have to do a transvaginal scan to look at the cervix, or if the placenta is low lying, that is, it is coming right up to the mouth of the uterus, or the placenta is low, or if the imaging from the abdominal side is not that great and we want to look at certain structures which are down, then we might do a transvaginal scan. If not, it is usually transabdominal. And when patients come for the anomaly scan, if they have had any previous baby who has had structural abnormalities, who has had any kind of genetic problems, it is very important that they mention that and come with the relevant reports. Now, of course, this applies even in your first trimester, but it is important because here this is where we are screening for abnormalities. So it is important that that we can look and check that that same problem is not recurring. If there are patients who have had babies who have had abnormalities or who have had some kind of a genetic problem, these are things that are important because we need to plan for testing of the present pregnancy. So if they have relevant genetic reports, then a sample of the amniotic fluid or a sample from the placenta called as chorionic villus sampling can be sent to rule out any kind of a genetic problem that there may be. So it is important that they also tell us if there is any kind of a inherited problem that is running in the family, or if the couple are married within the family, what is called as a consanguineous marriage. If they are like married to uncle's son, uncle's daughter, that kind of a thing, they need to mention it to us, because there are certain conditions that can be passed on down the families. The parents might be normal, but the baby can inherit certain issues. So this is regarding the anomaly scan or the TIFA scan, which is done at the fifth month. Following this, usually the babies only require follow up to look for the growth of the baby or the well being. So that includes the growth. We keep measuring the head, the abdomen, the leg, the limbs to check for the growth parameters. We have growth charts which kind of plot the pattern of growth. And we also look for the fluid level, whether the baby is moving well. We also look at the blood flows. This blood flows or circulation that we are looking for in pregnancy, we do something called as a Doppler study. Now, Doppler study is done to look for any kind of circulation. So, in pregnancy Dopplers, we are looking at the blood flow going from the mother to the baby. That is your uterine artery Dopplers. We are also looking at circulation, which is blood supply from the placenta to the baby in the through the umbilical cord. And then we see how the blood circulation is being used by the baby, or how the circulation is within the baby, by looking at the circulation in the brain. Now, these things are important, especially if the baby is growing along the lesser centile, so the baby is not growing as much as we expect, because this tells us whether the baby is getting enough nutrition, but more importantly, it tells us if the baby is getting enough oxygen. So when we look at the circulation, it gives us an idea whether the baby's basic body functions, that is like the heart, the kidneys, the brain, all of these structures are getting enough blood supply, whether they are able to function well, and if the baby's well-being is good. Because when a baby is having a problem, or is there is a deficit in the blood supply or nutrition, the baby or the body has a tendency to shift the blood supply or save the blood supply more for the important organs, so which is why the growth reduces. So it is important that we monitor the growth, so that we know that the baby, yes, it might be, saving or conserving its blood supply for maintaining basic body functions, but it is important that we know that the baby is not critically ill. If the baby is getting less oxygen and is actually suffering due to that, then the question arises, is the baby better off inside the uterus, or should we deliver and look after the baby outside? Because the baby is basically not getting enough oxygen, not getting enough blood supply. Whereas if we deliver the baby, maybe the baby will do better outside, where we can take care of the oxygenation and things like that. So, in patients who have growth problems, regular monitoring with growth scans is important, and looking at the Dopplers periodically is important. In a absolutely normal patient in whom the baby is growing along the normal patterns, usually we advise a growth scan somewhere around 28 or 30 weeks, and then we follow it up with another scan somewhere around 36 weeks. So that should be sufficient. In between, they will be seen by their obstetrician, who will do a clinical examination just to check if the uterus is growing as expected. And as long as things are looking normal, we just monitor with just 2 growth scans, maybe 3 at the most. Now, when so many, I'm talking about so many scans, the question that many people ask is, how many scans are you going to do in a pregnancy? So the basic scans, ideally, I would say will be 3. One will be your NT scan, one will be your anomaly scan or your TIFA scan, and maybe one growth scan. This will be the bare basic. But most commonly in the regular pregnancies in any normal hospital, what we usually do is, you might have a few more scans, We might have an early pregnancy scan just to make sure that the pregnancy is normally implanted, growth and development is normal, heartbeat has come, things like that. So that's an early pregnancy scan, which is additional. We have maybe one or two additional growth scans. So generally, patients, absolutely normal patients with normally growing babies, might have around 4 to 5 scans going through pregnancy. Some of them are concerned about getting the scan done itself. They are worried that getting the scan done is going to harm the baby. So this is a wrong notion actually, because when we are doing the regular ultrasound scans for pregnancy, we are using only ultrasound. It is sound waves. We are not using any kind of radiation. So there is no radiation exposure or any kind of a hazard to the babies. And even though we are using only sound waves, we are there is something called as in each of the scan images, there will be certain numbers seen on the top of each image. So those are all safety parameters, and every scan is done with that being monitored, and we always stay below the threshold where there is absolutely no potential of risk or harm to the fetus. There are some patients who require very close monitoring, especially if the baby circulation is having a problem. There are patients for whom we have done scans, maybe like 2 scans a week or even more, and all those babies are doing okay. So the scan per se does not cause any problem or does not harm the babies. Another thing I would like to mention here is patients. Yes, I've told you what all we see and things like that. But people need to understand that what we are doing is we are trying to look at as much as possible and rule out the most common problems that we encounter. But you must understand that an ultrasound examination is not a complete or 100% exclusion or a confirmation that there can be no possible problem. For example, when we are looking at the brain, we are looking at structures of the brain, we are looking for the development of the brain. We monitor the functions of the brain in terms of the bodily functions, whether how the baby is moving, the breathing patterns, whether the heart rate is, the variations that we see in the heart rate based on the fetal activity, things like that, which tell us about the basic brain functions. But there is no way we can assess the higher brain functions. For example, we cannot look or exclude autism, for example, because that is a functional aspect, and that those are things that evolve later as the child grows. So just by doing a scan we cannot rule out things like that. Similarly, chromosomal problems or genetic problems, just a scan cannot rule out those things. The relevant tests need to be done. For example, if there is a genetic abnormality in the family or in the previous baby, unless we do a sampling of the amniotic fluid or the placenta, send it for genetic testing, we cannot rule out these problems just by doing a scan. So it is important that the expectations, like patients come thinking that, everything or anything can be detected. So they need to be aware of what can be seen, what cannot be seen. Similarly, if, for example, looking at the heart, yes, at your normally scan, things might look great, everything might look normal, but as the baby grows, changes can happen. So, which is why growth scans, we monitor all the other things. We look at the heart, we look at the kidney, we look at the brain pattern, not just the measurements. Now, again, this is something that can be done, or any changes can be picked up ideally in a fetal medicine center by a good fetal medicine specialist. Not everybody is trained to pick up these things early. So it is important that people are aware of what we are looking for. So, do we have any questions at this point? I don't think we have any questions here. Okay. So I think we'll just wait for maybe a few more minutes, maybe 10 minutes more. And meanwhile, let's see if anything comes up. Right. So I think we'll end here. Thank you, everyone, for whoever's watching. Thank you. And if there are any questions, you can still type it into your chat boxes. We will try to answer them as soon as possible. Thank you.